Hello, I'm Dr. Miles Hassell. We're going to be talking about osteoarthritis and how you can often interfere with, in a good way, reduce your risk of this often debilitating condition. Osteoarthritis is a complex disorder. It's not just simply wear and tear of the cartilage of your joints. It involves a vascular supply, blood supply of the area, how well the fluid inside your joint is actually able to nourish the cartilage, the strength of the underlying bone, and probably many other factors. And one of the most interesting ones we'll be talking about is how insulin resistance, or this predisposition to diabetes or type 2 diabetes or prediabetes, actually accelerates the rate of cartilage destruction in ways that we don't really understand. So when we're thinking about osteoarthritis, if you're watching this, there's a pretty good chance that either family members of yours have it, or you have early stages of it and you want to do something about it. And so the risk factors are age, obesity, being overweight, previous joint injury or trauma, which would include previous surgery, overuse of your joint. That can be occupational, it can be recreational. If you're somebody who runs 20 or 30 miles a week on pavement, you probably are beating your knees up beyond their design tolerances. Abnormal orthopedics, in other words, how your joints are attached to your body, in some cases can accelerate the wear and tear on your joints. Family history, and one of the big ones in our society, possibly the biggest, is actually insulin resistance, by which we mean prediabetes and type 2 diabetes. A couple of thoughts about how not to treat your osteoarthritis. Don't assume it's going to get worse. Get in ahead of this. Take charge of your joints. Remember that pain medications can often actually probably accelerate the rate of destruction in the joint. So don't just throw down acetaminophen and ibuprofen and naproxen and think that you're doing your joints a favor. You certainly may treat the pain successfully, and that has some benefits, but don't think that it's going to improve your actual joint health in any way whatsoever. Anti-inflammatory medications and steroid injections do not help your joint health. They're pain medicines. And much of our data would suggest that they actually might accelerate the wear and tear, the destruction of your joint. So be fairly cautious about your use of pain medicines. And don't assume that joint replacement is inevitable. Many people they think that eventually they're just going to need a new knee or a new hip. And I think that's a wrong way to think. You might need a new knee or a new hip, and our joint replacements are getting better all the time. But even better is to stick to original equipment. So what are you going to do to take charge? First of all, make sure you get an accurate diagnosis. There's some things that can look like osteoarthritis that are not. So that's worth making sure you get a good diagnosis. Exercise is tolerated briefly several times a day. Make good dietary choices. We'll talk more about that. Achieve a successful weight loss. Reverse diabetes and prediabetes. And sometimes we use supplements. Let's start with exercise. Motion is lotion for the joints. And the best exercise is the one that you will do. What a surprise. So find out what works for you. Select things that are upper body and lower body. Have lots of variety. For many of us, exercise it's kind of boring, frankly. And so we find things that we can enjoy. I enjoy ping pong, pickleball, bike riding. I don't enjoy working out in a gym. We have a rowing machine. That works really well for me. I skip rope. But I do a little bit of all these things because I don't want to accelerate joint damage. And so I don't say to myself, hey, what don't I like? I say, what do I like? If your joints hurt, the more variety, the better. And the shorter duration of exercise, multiple times per day, the better results you're probably going to get. Don't hesitate to just start with simple walking. Walking for osteoarthritis has excellent evidence for benefit. Find some light weights. Maybe use a tool called a body blade. Rowing machines work great. Bicycles work great. Stationary or road bikes, either one. Just don't fall down. But whatever you do, do it. Do it in small doses. Do it several times a day. Don't beat yourself up more. And often people find a visit or two with a physical therapist to help guide them in some good home exercises can often be very helpful. The next thing to think about is weight loss. If you're overweight and you have osteoarthritis, weight loss is king, along with exercise, of course. And the three basic rules of weight loss are eat better food that you cook at home, and that involves eating less sweets, less refined carbohydrates, having a large serving of fruit or vegetables with every meal and snack, and don't avoid proteins and healthy fats. And for those of you interested in this kind of approach, we have a handout that's a free download on our website that runs through the basic rules of successful weight loss without needing any fancy tools. Eat a little bit less. Most people who need to lose weight need to eat just a little bit less every day, every meal. Stay active. Burning calories helps, but you can't lose weight in the gym as a general rule. It takes a tremendous amount of activity to lose weight successfully. Most of your weight loss is going to occur in the kitchen. And read our handout, go through all the different ideas in there, and I think you'll be successful. As part of all that is reversing type 2 diabetes and prediabetes. Many people, they have prediabetes or diabetes, they just say, hey, this is inevitable, my father had diabetes, my mother had diabetes, my aunt had diabetes, I'm just stuck. Well, you're not stuck. Most people with prediabetes and type 2 diabetes can reverse the whole process with better food, more activity, and our handout covers this as well. And also, for those of you who are not familiar with our book, Good Food, Great Medicine, it goes into considerable detail on how you can reverse diabetes. There are some specific dietary components that seem to be important. One is extra virgin olive oil. For some reason, that seems to really help joints. The Mediterranean diet alone is associated with less osteoarthritis. And don't overlook the many health problems, not just joint disease, but just about every other chronic health problem on the planet that's associated with refined carbohydrates, sweets, refined grains. And that means commercial breads, commercial pastas, commercial pastries, commercial crackers, ready-to-eat breakfast cereals, that kind of thing. And incidentally, for those of you interested, then we have all of the references to the points we're making are from the medical literature are in the end of this presentation. We do sometimes use supplements. Typically, we do a trial for about 3 months. Gelatin, about a tablespoon per day. People typically put it in a warm liquid, such as coffee. There's a form of gelatin called NutriJoint that's particularly easy to use. Glucosamine sulfate, about 1,500 milligrams a day for 3 months. Niacinamide, about 1,000 milligrams daily for about 3 months. Boswellia, about 1,000 milligrams daily for about 3 months, is all worth doing. There are many other supplements that are purported to help osteoarthritis. We've been mostly disappointed with them, actually, and much of the literature is very, very poor quality. If you're interested in the supplement line of things, consumerlab.com has a lot of information. And what you want to do is go to the actual articles about osteoarthritis and supplements and see what looks like it has convincing benefit for you. Most of our patients who are able to overcome their pain from osteoarthritis do so without supplements. So supplements are not the key. The key is good diet, weight loss, exercise. Let me tell you about a patient of ours who came to us. He was considerably overweight. He was on insulin for his diabetes. He had had one joint replacement. It hadn't gone all that well. He was wondering what else had he got. He was in his 70s. So we worked with him on a simple exercise program. He primarily used a rowing machine. That was sort of worked for him. And in weight loss, he lost about 60 pounds. He no longer needed his next joint replacement. He reversed his diabetes. He no longer has diabetes. He no longer takes insulin. Even the kidney damage from his diabetes was reversed. And he's now in his 80s and doing really, really well. Active, vigorous, and guess how many medications he takes? That would be pretty close to 0. So take charge of your diabetes. Exercise in small doses frequently. Reverse your any weight loss. If you need to lose weight, and reverse prediabetes and diabetes. Don't be easy on yourself. Take charge. Eat a whole food Mediterranean style diet, and emphasizing extra virgin olive oil in your kitchen. Maybe use supplements, and avoid harmful quick fixes. And by that I mean almost everything the doctor is going to offer you in terms of pain medicines and joint injections are probably a net harm. So be really cautious about whether you accept those. Thank you.